in this audio, I will begin with herniation. When there's weakness in the muscle wall of the abdomen where a part of the bowel can protrude, that is considered a hernia, okay? Hernias can penetrate defects in the belly wall, through the diaphragm, or through any other type of structure in the cavity. Now, an indirect inguinal hernia, that's when there is a sac that is formed and it contains a portion of the intestine. Okay, the hernia pushes down into the inguinal canal. In males, indirect inguinal hernias, these can become so large and descend into the scrotum. Okay, direct inguinal hernias, these pass through weak points in the wall of the abdomen. Femoral hernias, these are when a piece of fat in the canal becomes large and it eventually pulls the tissue, the peritoneum, into a sac. Now, umbilical hernias, now these are congenital. And umbilical hernias, they're congenital, so they're typically going to be seen in infancy, and surgery can be done to correct the umbilical hernia. Other umbilical hernias can occur from obesity. Okay, now incisional or ventral hernias, these can occur, let's say that someone had an abdomen surgery. Let's say they had appendicitis and they were straining when they shouldn't have been. They lifted, greater than 10 pounds before those 2 weeks were up, and they got a hernia. That would be an example of an incisional or ventral hernia. Now, a hernia is reducible, but it can also be irreducible. An irreducible hernia is one that cannot be placed back into the cavity, okay? And any hernia that cannot be placed back into the cavity by general pressure, the patient needs surgical evaluation. Now, if a hernia becomes strangulated, that is when the blood supply is cut off because of pressure. Okay, now that can lead to necrosis and even bowel perforation. Strangulation signs are abdominal distension, nausea, vomiting, pain, fever, and tachycardia. Now, typically the patient will come in and they'll report a lump or something poking out of their skin. And hernias typically are associated with straining and lifting. The hernia that is reducible, it can disappear when the patient's lying flat. Oftentimes, if you have a patient lying flat and they lift up their head in the bed, you can see that hernia, it's more prominent. Now, absent bowel sounds, those can be indicative of obstruction or strangulation, okay? Now, absent bowel sounds, would we consider this a medical emergency or something that is not life-threatening? So, absent bowel sounds, we're going to consider that a medical emergency, especially when we think that obstruction or strangulation might be occurring, because if blood flow is not getting to the intestines like we need it to, then the bowel can become ischemic and die. Now, a truss is a pad that's made with material, okay? It's applied after the physician has reduced the hernia to help keep the contents of the abdomen from protruding into that sac, okay? Now, there are different types of surgical management for hernias or herniation. A minimally invasive inguinal hernia repair is typically the surgery that is chosen. Hernioplasty is also performed. The surgeon reinforces the muscle that's weak with a mesh patch. Okay, now it's important for these patients to avoid any strenuous activity for the next few weeks after surgery, and they might also want a stool softener because any increase in intra-abdominal pressure or any straining can cause these patients to develop another hernia. The patient should observe the incision for any type of infection. The patient should also avoid coughing, okay? But we do want to promote deep breathing and ambulation. If the patient has had an indirect inguinal hernia, typically for a male, ice bags can be applied to the scrotum, and elevation of the scrotum can help with swelling. Now, with inguinal hernia repairs, sometimes the patient can have difficulty voiding. We want to monitor for urine output that's less than 30 mLs per hour. Okay, we want to make sure that these patients are getting enough intake as well. In the next audio, I'll begin with colorectal cancer.